Okay. Hello everyone. So welcome all. I hope you have done your exam very well. Uh, we'll see the recall questions of forensic medicine. These all questions are based on the memories of students who have given the exam. So the language of the question may be different or options may be different, but mostly 90% of them I think are correct because I've asked from multiple sources. So first question, if you see, the question paper was basically mild to moderately difficult, not that difficult, and it's basically okayish kind of paper. Almost 10 questions were asked. So first question, if you see, a doctor receives two summon on the same day. One to appear as a witness in a murder case, and other to provide expert medical opinion in a case of medical negligence. So they are asking which of the following should the doctor प्रायोरिटाइज. सेम डे पे एक मर्डर केस के एक्सपर्ट विटनेस के तौर पे आपको कोर्ट में जाना है और सेम डे पे ही एक एक्सपर्ट मेडिकल ओपिनियन इन नेग्लिजेंस केस है. आप कौन सा प्रायोरिटाइज करेंगे एज अ डॉक्टर? तो आई हैव ऑलरेडी टोल्ड यू इन माय क्लास, क्रिमिनल ओवर सिविल. तो मेडिकल नेग्लिजेंस केस कैन बी सिविल ऑल्सो, बट murder case is a criminal case. So the option here were appearance in a murder case, appearance for providing medical expert opinion first, the summon received first, the case involving a medical issue. So the answer is appearance in murder case. It is as simple as this. Criminal case should be prioritized more than what? More than civil case. Okay. So now second question is, a deceased woman was found in a locked room with a heat stove still burning. During autopsy, there were no sign of external injuries. What is the most likely cause of death in this scenario? So it is a very easy question. Locked room, then heat stove burning. What could be the cause of death in such scenario? The favorite and the most easiest question here, and the answer is carbon monoxide poisoning. Carbon monoxide poisoning. Here what you get in autopsy, PM lividities, cherry red, discoloration of skin. Now moving on to the third one. A man was abducted from his home and has been missing since. His son has claimed right to his father's property as per section 101 of Bharatiya Sakshya Adhiniyam (BSA). For how long must the father be presumed alive, and hence son is not entitled to claim inheritance? The options were 5 years, 6 years, 7 years, 10 years. So this is a factual based question. If you know the answer, you can mark it correctly. Otherwise, you won't be able to. You won't be able to apply any concept here. Okay. So since BSA, BNS and BNSS were the new updated thing in forensic medicine, so they have asked a couple of questions on that topic. So the father was abducted from his home and missing. They're asking for how much time the father is presumed alive and son is not entitled to claim inheritance. The answer to this question is 7 years. I hope many of you has done this question correctly. A person was found dead in a swimming pool. On autopsy, his lungs and stomach were filled with water, and mucoid froth was present at the nose and mouth. What is the most likely mode of death in this case? See, again it's a easy question only. A person was found dead in a swimming pool. ऑटोप्सी में आपको लंग्स और स्टमक में पानी मिल रहा है एंड देर इज़ अ म्यूकॉइड फ्रोथ फ्रॉम नोज, तो मोस्ट लाइकली इट इज़ अ case of wet drowning. The answer was wet drowning. Okay, so answer was wet drowning. If you see the next one, in a bomb blast incident, a person sustained a rupture of tympanic membrane due to blast wave. This type of injury is classified under which category of blast injuries? So, bomb blast हुआ, sound waves will cause tympanic membrane rupture. So it is a primary blast injury. The answer is primary blast injury. Answer is primary blast injury. Moving on to the next one. A patient presents with sign of opioid overdose, including respiratory depression, pinpoint pupil, and unconsciousness. Which of the following is the antidote of choice? In my revision session also, I have given you this question, and the answer is naloxone. It is a opioid overdose, and the antidote for this is naloxone. Antidote. Okay. A baby, a baby is brought to the emergency department with multiple injuries to chest and abdomen, along with fractures of both knees. The history given by the caregiver is inconsistent with the injuries. What is the most likely diagnosis? So, things to see here is multiple injuries to chest and abdomen, along with fractures of both knees. The history given by caregiver is inconsistent. What is the answer of this question? Seems the answer is battered baby syndrome. Battered baby. As per BNS, Bharatiya Nyaya Sahita, what is the maximum punishment for making a false document? Now, forgery comes under section 336 of BNS. And for forgery, the punishment can go from 2 years to 7 years, depending on the intent. If the intent of the person was to cheat by doing forgery or false documentation, the punishment is 7 years. They have asked about maximum punishment, so the answer is 7 years. Answer is 7 years. A child was found playing in agricultural field. First clue, and was later brought to the emergency room with symptoms of salivation, sweating, meiosis, and breathing difficulty. Which of the following substances is most likely cause of accidental poisoning of in this scenario? So agricultural field, salivation, sweating, meiosis, breathing difficulty. The answer is pretty clear here. It is organophosphate poisoning. Organophosphate poisoning. Now, this question. A alcohol dependent patient is admitted to hospital 48 hours after his last drink. He presents with altered consciousness, disorientation, severe agitation, tremors, and hallucination. What is the most likely diagnosis? Patient is admitted for 48 hours after his last drink, altered consciousness, disorientation. Clearly, his mental capabilities are lost. He is in encephalopathy, severe agitation, tremors are there, and hallucination. So, motor and sensory, both problems are there in this person. So the most likely diagnosis is delirium tremens. Delirium tremens, which is due to alcohol, chronic alcohol or chronic alcoholism. And the answer of this question is delirium tremens. So basically these were all the questions which we have got by you students only, and the question paper was relatively easy only, not that difficult, and I hope you have done all questions correctly. Okay, thank you, goodbye.